recent years, India has seen a massive surge in digitization of healthcare. With Airtel 5G connectivity, quality healthcare could be accessible to anyone, anytime, anywhere. Specialist doctors across the globe will be able to cater to patients anywhere, even including rural areas. What we are going to see now may seem like it's out of Star Wars, but it is here for real. Check out the Apollo 5G ambulance, powered by Airtel 5G and Cisco.
Hi, today I'm going to be talking about something very interesting. It involves about connected health. It involves about saving lives. It involves about caring for people and putting technology to use. And the whole idea is about how do we assess the health of the patient, how do we diagnose the patient, how do we monitor the patient in a life cycle, in the whole life cycle of the patient's health at the time of trauma or distress. So what we see here is a whole plethora of medical equipments, and we've got a defibrillator here, we've got a patient monitor here, we've got a syringe dispensing pump, we've got a ventilator and a BiPAP machine, a suction machine. The whole idea is to connect all these devices and be able to transmit or transfer in real time this information back to the hospital screen. Let's look at two windows specifically. One of them is essentially where the hospital is looking at the whole fleet management of ambulances. The hospital wants to take a snapshot of where my ambulances are, where do I dispense or where do I send the next ambulance to? Is there a catastrophe? Do I need to send 5 ambulances there? So all of that is visible in a single UI. And you see right here, you can actually track the patient, the time it's going to take for the patient to get into the hospital. Now that he or she knows that you're receiving 5 ambulances with 2 critical patients, or all the 5 being critical, because you've done that whole first step of diagnosis right there. Here's where the doctor is really looking at the patient's vital statistics right at the moment when he or she's being rolled into the ambulance. One of the ways is you have a camera, a high resolution camera, that's showing you the device and how do you set the parameters of the device. For example, an injection dispensing pump or a syringe pump, right? And you got the patient video. You can do a pan, tilt, zoom, the basic characteristics of any kind of a video, so that he can understand or diagnose the patient really well. You got a window where you can see the ventilator statistics. So as soon as the patient is put on the ventilator, I as a doctor can start monitoring the critical vitals of that patient. And of course, the last but not least, you've got an ECG, you've got heart rate, you've got SpO2 monitoring, all of those combined into this whole bouquet of information that the doctor can then use to diagnose the patient.
Good health and great doctors are indispensable to a quality life. With its 5G services, Airtel hopes to further fortify the healthcare ecosystem.